I think local government is well placed to assess eligibility for care and support because it understands the needs of local communities, and what people want is local services that meet their needs. And I think that local authorities have the connections with local health care, they have the connections with the local voluntary sector, they have the connections with parish councils and borough councils. So what people will often say to us is, they want fairly low level support, which will then help prevent them needing longer term support later on. So there's things like they will tell us they want help with gardening, they want help to access their local community centre, they want to access shops in their community, etc. And local authorities are well placed to make the connections and enable people to access those services. So make sure they're there, and then make sure people can access them.
I think that the standard of eligibility should be set nationally. I don't think it's appropriate at all that if I live in one place, I might get a certain level of care, and if I live in another place, I might get a completely different level of care. I think there should be a national standard. Having said that, I don't think it's practical to have a national body, or that everybody troops up to the Department of Work and Pensions in London, for example, to get assessed for their care need. So given that, I think that the individual themselves should be the primary person who does the assessment, as it were, then I think that the oversight that I was talking about should come from the local area.
One of the things that people told us through the commission was that the different funding streams was very, very confusing for people, with different eligibility levels, meeting one criteria here, a different criteria here. And they said very clearly that there ought to be much more coordination between funding streams, so that it was very clear what people could expect, and they weren't having to jump through endless hoops and prove their need to a diverse set of agencies. So I think it's really important for people to just have one agency that they can go to, that can support them with assessment and then can help them manage their budget. And I think local authorities, because of their experience in adult social care, are well placed to do that.
Well, we believe that the private sector has got a huge role to play in the funding of long-term care and support, as have many other organisations. And the problem facing us, I think, is so huge that we do need all parties to come together to meet this significant challenge. What the government really needs to do is partly this settlement we need, so that people are absolutely clear about what it is the government will do for them and what it is people need to do for themselves. That's very important. People can only plan ahead if they know what they're planning for. We'd also like to see the government setting out a national eligibility criteria for needing care, so that when you need care is the same if it's in one local authority as another. So we've got a national criteria for judging people's care needs. That's very important for the private sector to get involved as well, because it means that we know how to price any insurance products. We know what the criteria will be for people claiming. Whereas if you don't have a national criteria for that, then of course insurance might cost more in one part of the country than it does in another, and that would be quite difficult to manage. And of course, also there are questions about how fair that would be.
I think portability is absolutely essential, that people should have the opportunity to be able to move around. In the current system, the traditional system of services, if you have a disability or a support need, it's very hard to move from one place to another, i.e. one local authority to another. I think if there was that individual budget that was allocated to you, that would give you the freedom like everybody else in this country takes for granted. Because it might be that you want to be closer to family and friends who live either in the next local authority or at the other side of the country. I mean, what's important to people is that as people, we don't live in local authority boundaries. We make access to in our community in a way that makes sense to us. So there aren't walls built around certain councils, and people should have that portability to do whatever they want.
Well, I think citizens have a right to expect a minimum level of provision, and they certainly have a right to expect the sort of information about what local services are available and advice as how best to access them. So I think what we could agree between local and central government is something that recognises that, a basic level of service provision and certainly the advice and information that goes with it, with local variability beyond that depending on the needs of the area.
Well, I believe that the private sector wants to deliver simple, safe, affordable products to meet people's needs in care. And if we do have simple, safe and affordable products, then people will be able to trust them because they will do exactly what they say on the tin, to coin a phrase. But of course, to enable us to offer those simple, safe and affordable products, we do need to share the risks with government so that it's not the consumers themselves who are left carrying those risks. And of course, the way that manifests itself is with products that have lots of small print. We really don't want that.